Hi, good morning. I am Alyssa Jane Lucas and I will be your nurse for today. How can I help you with your concern, ma'am?
Hello nurse, I just want to ask you for some advice because me and my partner wants to have a baby, but my partner has a low sperm count. What should we do to increase the fertility of my partner?
Thank you so much, ma'am, for the cooperation, and I assured you that all this information will be kept confidential. Okay, I just want to ask you if you and your partner aware about something that causes of the low sperm count.
Yes nurse, but my knowledge about that is very limited.
Okay, since you are not aware with that regarding to the cause of sperm count, so I can explain it to you the things that your partner needs to know to increase his fertility. So these are the things that barrier that cause low sperm count, most especially also the lifestyle. So if your partner drinking alcohol, smoking, so they must need to lessen, including the stress and depression. I really suggest to you and your partner to avoid this, so it can help to the both of you.
Okay nurse, I will explain this to my partner later on so that we can avoid such things.
And next, mom, I advise to you the things that your partner needs to increase sperm count. He must need to exercise regularly to maintain a healthy body, and also it may help to boost testosterone level and improve fertility. And also, he must get enough vitamins C, and relax and minimize stress to lessen things that can make you feel stressed out. So this some advice to is help. I hope it will help to you and your partner to lessen to stabilize the sperm count. So I hope it can help to the both of you, regarding to your conditions. So, thank you.
Okay nurse, thank you for sharing this information. It will help us a lot.
Hi ma'am, good morning. My name is Cynthia Nicole Manila and I will be your nurse for today. And may I know your name ma'am, your age, and what is your concern po? Ma'am, do you have any idea about contraception methods or contraceptives?
Yes po nurse, may alam po ako pero very limited lang po.
Ma'am, we have contraceptives method po that is divided into two categories. The first is natural contraceptives and applicable po ito sa case nyo, which are the abstinence, calendar rhythm method, cervical mucus method, basal body temperature method, symptothermal method, and coitus interruptus. Yung abstinence po ay nagre-refer sa voluntary prevention of oneself from indulging in bodily activity that provides pleasure. Ito po yung pag-iwas nyo sa mga bagay na nakakapagpabigay sa inyo ng pleasure. Then yung calendar rhythm method naman po ay isang natural family planning. Ito po yung itatrack nyo yung menstrual history nyo para ma-predict nyo kung kailan kayo mag-ovulate. And then yung cervical mucus method ay isa ring natural family planning, which we also called fertility awareness based method. The next category po is the artificial method at ito po ang applicable sa case ninyo. The first one is use of male condoms. The advantage of this are lower the risk of acquiring STI and it doesn't cost much and accessible and affordable. While disadvantage is women may be allergic to latex, too much consuming, disrupts sexual activity, and requires proper knowledge upon using. And the second one is use of female condoms. The advantage of this can be inserted before sexual activity, so it less interruption and no need to withdraw. And the disadvantage of this, it may be uncomfortable because it's unusual things for the women. So that's the applicable contraceptives for your case, ma'am, and we will advise or suggest to use the calendar method or the use of female and male condoms that will suitable for your case and very accessible and affordable. Thank you, ma'am.
Okay po. So, good morning, ma'am. I'm Nurse Miss Lacanlale and I will be the one who will guide and help you about your health concern po. So, I will provide some knowledge or to educate you about being ready for childbearing po. So, can we start, ma'am?
Yes po, ma'am.
Okay po. So, since this is very confidential, and I assure that there's no other people in my room, and I'm hoping that you will cooperate po. And to identify what is nursing intervention that is applicable to your problem or therapy po. So, may I ask you, what do you consider yourself to be po? Okay. What is your current gender
Yes po,
identity?
ma'am. Straight female po, ma'am.
Okay, ma'am. So, before we proceed to the questions po, and can I ask what is your name, ma'am?
Patient Gallardo po, ma'am.
Okay. So, ma'am, pwede na po ba tayo mag-start?
Yes po, ma'am. Salamat po in advance, ma'am. Jane. Opo.
Walang ano man po. So, mas nakakaintindi po ba kayo ng
Yes po,
Tagalog?
ma'am. Opo.
Okay. May I ask you, ma'am, if taga saan ka po?
Bali, ma'am, laking Pampanga po ako, ma'am. Pero isang taon na po kami dito sa Zambales.
Ay, ma'am, dyan din po kami nakatira before. Saan po kayo banda, ma'am?
Sa Angeles po, ma'am.
So, ano po yung trabaho nyo since tayo lang naman po nandito and free po kayo magsabi. And I guarantee na walang lalabas na information about you.
Okay po. Maraming salamat po, ma'am Jane.
Okay po. So, anong work mo dati sa Angeles?
Ang trabaho ko po is, bali, waitress po ako, ma'am, sa bar po sa Olonga po, ma'am.
So, may I ask you, ma'am, if you are ready to answer the sensitive questions po regarding sexual health?
Yes po. Opo.
Okay. I'm going to ask you a few questions about your sexual health. Since sexual health is very important to overall health, I ask you as adult patient. Okay. Before I begin, have you been sexually active?
Yes po, ma'am.
Okay po. If I ask you to rate po, kung gaano kadalas po kayo nakikipag sexual intercourse or kumbaga po sa isang linggo, ilang beses po?
Bali, 3 po, ma'am.
Okay po. So, Do you have sex with women or men or both?
With men lang po, ma'am.
Okay po. So, have you ever traded sex for money or drugs?
Yes po, ma'am. Lagi po yun sa trabaho ko, ma'am.
Okay. Okay. And the past 2 months, how many sexual partners have you had?
Hindi ko na po mabilang, ma'am, given na waitress ako, ma'am. Yung nakukuha ko pong tip, ma'am, ay nakakatulong sa amin. Gawa ng kami ay mahirap lang, ma'am.
Okay. Do sexual encounters usually include vagina, oral, or anal sex po? Ay ma'am, sorry po sa mga questions. Anytime ma'am, kung ready na po kayo, sabihin yung answer if nahihiya po kayo.
Salamat po, Ma'am Jane. At gawa nga po niyan, ma'am. Lahat po ng tanong ay i-entertain ko, ma'am. Kasi, ma'am, gusto ko pong malaman yung sexual health status ko, ma'am.
So,
Opo, ma'am.
thank you ma'am po in advance for cooperating, and I will assure you that we will identify your sexual health problem. Okay po ma'am. Proceed po tayo sa another question. Okay. Do you use condoms always, sometimes, or never?
Sometimes lang po, ma'am.
So, have you had all your routine recommended vaccination like hepatitis B or HPV po?
Never po, ma'am. Opo.
Oh. Okay, ma'am. Do you have any questions, or if you want to add anything before assessing the risk of infection? So, ma'am, proceed na po tayo for educating you about childbearing po regarding sa sexual health problem na na-identify po natin. So, HIV or human immunodeficiency virus, it is a type of infection po. So, in pregnancy, it can lead to miscarriage po or stillbirth. And it can also be passed from mother to baby. But today's highly effective routes can prevent mother-to-child transmission of HIV. Yung therapy na po yun is, it can prevent the transmission around 98% of the time. This is anti-retroviral therapy po, or ART. Okay. Oh, how can you reduce your risk of getting an STD while you're pregnant po? So, the only way to avoid STD is not to have vaginal, anal, or oral sex. So, ma'am, I will recommend to be monogamous na po. Maging isa lang po yung inyong partner, yung pag niyo po sexual intercourse, and also yung pag-use po ng condoms, contraceptives. It is needed for sexual intercourse kahit na hindi infected yung, or hindi mo pa alam na infected pala yung partner mo or yung sexual intercourse mo. You need to use condoms for or contraceptives. Okay, ma'am. So, okay, thank you, ma'am. And okay, dinodocument ko po siya and for legalities po. And also, to identify nga yung nursing intervention na gagawin regarding doon sa sexual health problem mo po. So, that's for today. Thank you, ma'am. And I hope na magiging okay na kayo, and also sa mga payo ko na nabawasan or iwasan, lalo na iwasan ang pag-sex sa ibang tao na hindi naman protect. protected. Like walang use na condoms. Okay, ma'am. Thank you, ma'am, and have a good day po.
Okay po, maraming salamat po, Ma'am Jane.
Good day. May I know the reason why you are visiting our clinic?
That's why we decided to consult a professional because we think that there might be a problem within uh, physically with either one or both of us.
Ganun po ba? Di lang po kayo nakaka-experience ng ganitong problema. In fact, most of our clients come to our clinic having the same problems as yours. But to be more precise, may I perform a quick assessment and ask you some questions?
Sure.
May I ask you how your menstrual cycle and may I also know if you feel any abdominal pain or experience symptoms of STI?
I'm 27. My menstruation cycle have changed in the past few months from 28 days to 32 days. I also don't feel any symptoms of STIs, and also I do drink and smoke because it helps me to relieve my stress.
Can you tell me more? Ano pa pong mga nakaka-stress sa inyo?
Actually, the one thing that stresses me is my work. I've been working on my company with accounting and finance department for almost 5 years, and at first I was happy and from my job and workmates, but when the department hand was replaced by someone who is very toxic and strict, we've been loaded with piles of work to the point that we can't have any time to eat anymore. And also, I think our home, nagkikitira po kasi kami sa family ng husband ko. 12 kami sa iisang bahay, sobrang gulo at ingay lagi. Pagod ako sa work, then pag uwi ko, hindi pa din ako makapagpahinga agad.
Ma'am, your stress may be the reason why you can't bear a child. Given the fact na hindi nakakain at nakakatulog ng maayos, at madalas din ang paninigarilyo at pag-intake ng alak. At higit sa lahat, your home and your work environment is not healthy for you. When you are too stressed, cortisol disrupts the signaling between the brain and ovaries. Dahil dito, naapektuhan ang pag-ovulate. Not just that, your meals should be healthy for you to have enough nutrition. Second is, you should watch your weight. Kasi minsan kasi pag stress, mas natatempt tayong mag-intake ng mga pagkain that can give us emotional comfort like sweets, unhealthy cravings, beers, and many more. These foods can increase your weight. Just so you know, ma'am, being overweight or obese can make it harder for you to get pregnant. Kasi nalilesen yung chances mo to ovulate. And another advice is that you should exercise and be physically active. Ma'am, you don't have to go to a gym to exercise. Sa office nyo, you can perform a 5-minute stretching. Lalo na't lagi kang nakaupo sa work mo. Then, when you have time to work out, at least 30 to 60 minutes. Because physical activity lowers stress and boost fertility. Lastly, kung kaya nyo, ma'am, I suggest na lumipat na po muna kayo ng bahay. If you want to get pregnant, you should consider your home environment para sa'yo and para na rin po sa future ng baby nyo. You should have enough space and have a peaceful house para mabawasan yung stress and for you to rest well pag uwi mo from work. For the medications and for the diagnosis po, si Dr. Valdez na po ang makakausap nyo.
Hi, Mrs. Hermosilla. I am Mila Janay Payumo, your nurse for today. And I just want to ask you a little bit question for your situation for now. So first, is there anyone of your family side or your Mr. side are barren?
Good morning. No.
Okay, ma'am. Are you stressed or lacking of sleep?
Yes, I've been feeling stressed out and anxious lately.
Okay, ma'am. Stress kasi, ma'am, will take a toll on your health, both physically and mentally, and affect your ability to get pregnant. Stress din po kasi, ma'am, hampers the hypothalamus function, which control the pituitary gland. This gland regulates adrenal, thyroid, and ovaries, and affects the periods, even leading to irregular periods. So, ang may offer ko lang sa inyo, ma'am, is iwasan ng stress, ma'am. Ang kailangan mong gawin is to exercise and magpahinga din po tayo para hindi tayo na-stress, ma'am. Kasi yun yung nagkakos kung bakit hindi kayo nakakabuo ni Mister. Thank you.
Good day, Mr. and Mrs. Diaz. May I know the reason why you visited our clinic?
Me and my wife, we're almost married for 2 years. But even though we are trying to make a baby, there are no pregnancy at all. I don't know why.
That's why we decided to consult a healthcare professional because we think that there might be a problem in either one or both of us.
Oh, I see. Don't worry. It's not just the two of you who are experiencing this kind of problem. In fact, most of our clients come to our clinic having the same problems as yours. But to be more precise, may I perform a quick assessment and ask the both of you some questions?
Sure.
Okay, that's great. I'm going to start with Mr. Diaz. Sir, may you state your age and may I also know how is your voiding patterns or if there is any change happening with it? Do you feel any abdominal pain or any symptoms of sexually transmitted infections?
Yes, ma'am. I am 28 years old. I don't feel like I have STI. I do feel the abdominal pain here in my chest, but maybe because it is because of indigestion. Okay, ma'am.
Sir, does your lifestyle habit include smoking or drinking alcohol?
Okay, ma'am. I don't smoke, but I drink occasionally when we have a family get together like that.
Thank you, sir. How about you, ma'am? May I ask you the same questions, but instead of your voiding patterns, May I know, how is your menstrual cycle?
I'm 27. My menstrual cycle has changed these past few months from 28 to 32 days. I don't feel any symptoms of sexually transmitted infections, but I do smoke and drink because it helps me to relieve my stress.
Ma'am, ano pa pong mga bagay ang nakaka-stress sa inyo?
One thing also is our home. Nakikitira lang kasi kami sa family ng husband ko and 12 kami sa iisang bahay. And sobrang gulo and ingay palagi. Imagine I'm tired with my work pagka-uwi and then hindi pa ako nakakapagpahinga agad.
Ma'am, your stress may be the reason why you can't bear a child. Given the fact na hindi ka nakakatulog at nakakakain ng maayos, madalas ang pag-intake ng alcohol at paninigarilyo, at higit sa lahat, your work and home environment is not healthy for you. Matalino kasi ang katawan natin, ma'am. It knows that periods of stress aren't good times to have a baby. When you are too stressed, cortisol disrupts the signaling of brain and ovary. Dahil dito, naaapektuhan ang pag-ovulate. So ngayon, ma'am, I'm going to give you some advices on how you can manage your stress and how you can take care of yourself. First, eat a healthy diet. Ito ang pinaka-importante, ma'am. Kahit gaano ka ka-busy, you should allot time for your meals. Not just that, your meals should be healthy for you to have enough nutrition. Second is, you should watch your weight. Minsan kasi, pag masyado tayong stress, natatempt tayong kumain ng mga pagkain that can give us emotional comfort like sweets, chocolates, milk tea, unhealthy cravings, and beers. Alam naman natin na itong mga pagkain na ito ay nakakapag-increase ng weight. Just so you know, ma'am, being obese or overweight can make it harder for you to get pregnant kasi mas nalilesen yung chances to ovulate. Another advice is that you should exercise more and be physically active.
How can I do that? I mean, wala po kasi akong time magpunta sa gym.
Ma'am, you don't have to go to a gym to exercise. Sa office nyo, you can perform a 5-minute stretching, lalo na't lagi kayo nakaupo sa work nyo. Then when you have time, work out for at least 30 to 60 minutes because physical activity, Then, when you have time, work out for at least 30 to 60 minutes because physical activity lowers stress and boosts fertility. Lastly, kung kaya nyo, ma'am, I suggest na lumipat na po muna kayo ng bahay. If you want to get pregnant, you should consider your home environment para sa iyo and para na rin sa future baby nyo. You should have enough space and have a peaceful home for you to rest well pag uwi mo and para na rin po mabawasan yung stress nyo.
Okay po, sige po ma'am. Siguro maghanap na lang po ako ng bahay para po sa para sa future family ko at para sa ikabubuti namin pamilya at ikakabubuti rin ng aking asawa. Yun na lang po siguro, no?
Yes, sir, you should consider that. And I want you to provide emotional comfort para kay Mrs. Kasi kailangan niya po yun, lalo na stress siya.
Okay po, I'll take note that po. Meron po bang gamot na i-reseta sa asawa ko?
For the medications and further diagnosis po, si Dr. Valdez na po ang makakausap ninyo.